Hey YouTube. So I ruptured my Achilles playing pickleball about 3 weeks ago, and I wanted to just make a video, about my experience. It's been about 3 weeks now. So I ruptured it. Today is May 16th, so it's a Friday. So I decided, I might as well just spend a weekend putting a YouTube video together to maybe help out some folks that kind of going through what I'm going through, or just rupture their Achilles, or maybe even help like medical professionals, I guess, how to talk to their patients, and what to help them understand what to expect, and maybe even refer this video. So I ruptured my Achilles on a Sunday, on April 27th of 2025, and had my surgery about 2 weeks ago. So I had my rupture Sunday, and I had my surgery about 10 days after, basically about a week after. And then, I just had my first follow-up, and I'll kind of go over this timeline, using a calendar. But yeah, I just want to come on here and, hopefully help out people, at least for this video, kind of talk about what to expect for the first 72 hours, different pointers and tips to help you, kind of help at least show my experience and what to expect, and kind of help also prepare, what to buy, to what to expect, and help you with maybe like your decision process to, with going surgical and non-surgical routes. So yeah, hopefully this video helps. And if you're interested, I'll be making other videos regarding Achilles, and my experience and the different products I used, and what to ask doctors and stuff like that too. All right, so I made a little calendar just to showcase a little bit easier, about my where I'm at now, and just to help visually see it easier with what to expect for the first first 72 hours, right? So this calendar is from Monday through Saturday, or Monday to Sunday. It's the only calendar I can find really quick, so just bear with me and just kind of follow along. So April 27th was a Sunday. I was visiting Seattle, and I ruptured my Achilles playing pickleball at 1 p.m. So kind of the same story that most people talk about. You felt like you got kicked, in the leg. To me, I thought it was like a soccer ball, and I looked back, and people were not reacting the way I thought it was gonna be, right? And I fell to the ground, and then I kind of just knew automatically, my Achilles ruptured. I looked down at my ankle, and you kind of feel it, and you feel like your tendon is just it's not there, and you can even see it, from comparing it with your other Achilles, right, where you have your Achilles showing, and the other side it's basically not there. It's your rear ankle, just above your rear ankle, it's dipped in, at least in my case. And when you rupture it, right now it's let's say it's April 27th, right at 1 o'clock when I actually ruptured it. You generally don't want to really walk on it. I know some people can, right? Maybe adrenaline's rushing or whatever. But as soon as you think it's a ruptured Achilles, you want to keep your toes pointed down. They call it plantar flexion. Maybe I'm saying it incorrectly, but basically what it is you want to keep your toe like a ballerina. So imagine if this is your toe, you kind of want to just keep it, pointed down. And the reason why is because, your ankles, your ankle bone, I guess, is connected to your tendon, and you want that tendon to be, because it retracted back up when your foot is on, flat, you want it to be closer so that it's not healing improperly, when you ruptured it. And you kind of want to the tendons want to be closer together so that the healing process starts, much earlier, right? Especially right after the injury. So I guess good practice. I don't know how relevant that is for the first, couple of hours or whatever, but that's basically what the doctor is going to tell you, as you go through your different doctors, with your specialists and ER and etc. And I'll kind of explain that too, right? So yeah, you want your foot at plantar flexion as soon as you ruptured it, right? And then try not to walk on it, and try to get carried to the car or whatever. For me, I went to the ER directly. For some reason, other folks, I guess, didn't go to the ER when it happened. I think whatever the case is, I just thought it was the right thing to do. Just go straight to the ER, right? And what I've learned is, if you decide to go to the ER right after, and instead of just going to urgent care, a couple days later, or whatnot, kind of just going the non-operational route, just waiting to heal. If you do end up going to the ER, like what I did, I spent about 2 hours there when I was at the Seattle VA. The VA is where it's a hospital for all the veterans. And when I was there, I was kind of lucky because it wasn't too busy. It was a weekend. It was 1 o'clock. It was in the middle of the night, so kind of really very fortunate that it all kind of aligned, right? And I had friends when I ruptured my Achilles to help me get into the car, and I had my girlfriend drive me to, the VA. So, very fortunate for all that. And, I left with crutches and a boot, a surgical boot, which is basically, a boot that goes up to your, the entire length of your shin. And then it basically just keeps your entire, ankle and foot stable, right? And you can probably Google search this, or maybe I can share one later. But you want to make sure you try to get those two, at least a boot from the ER. But when you're at the ER, just to get ahead of a lot of the administrative things, right? Regardless if you're doing insurance or trying to go surgical or non-surgical, I think you should at least try to ask for all this, right? So when you're there, you're going to go through a couple of tests, at least from my experience, right? Which is the big one being Thompson test. I'll let you just Google what it is, but basically it's a test that tests your Achilles directly, right? I think a lot of sports medicine folks use it, but basically it's a very common test that you'll get through the same test, from your ER to your orthopedic, and whatnot. So when they're gonna make you stand on it, but you're gonna want to make sure that you try to get an X-ray at least, just to get ahead of that, and then very unlikely, but try to also get an MRI scan. If you can get out of the ER with an MRI scan, first of all, a boot would be minimum, a crutch would be pretty good, probably the average experience. And then an X-ray and an MRI, man, that would be you'll probably be ahead of the curve by a lot, just from getting all those checked off, and on top of that, getting a referral from your ER doctor with orthopedic. I don't know how likely or unlikely that is, but it seems like that would be the 5 golden things to get to make sure that you're really ahead of the curve, to making sure that the rest of the process is very smooth. Especially if you're going to go with the surgical route or not, right? Because you know how delayed medical appointments go and such. So, at least for me, I got an X-ray, which basically doesn't really test for, your Achilles. X-rays only just, scan the bone. But basically what it does is that it allows, the just one variable to be taken away, which is specifically broken bones, and that's essentially what X-ray will do, right? And you want to kind of get that, and the doctor already knows, from the Thompson test that, your Achilles been ruptured and there's no really, issues with the bone, but you still want to get that X-ray done, or as soon as possible following up from that, right? And then when you get your boot, it's basically this large boot. You can probably buy off Amazon if the ER isn't gonna, give you one from your insurance or whatever, and you want to get a boot. There's a couple of boots that's available. I would get specifically a Vacoped boot, essentially specific for Achilles, and I'll try to post that here maybe, and just trying to make sure that your heel's elevated, right? So I'd be very surprised if here you didn't get a boot where you didn't get your heels elevated. At least from my visit, I didn't get there wasn't a specific heel razor. What the nurse did was actually just used like a foam tape and just made a fat pillow for my heel, and then put it in, placed in my heel, and then was able to at least put some elevation into my heel so that the healing process is better, essentially, right? Surgical and non-surgical or not. If you're going non-surgical, you should for sure keep that toe pointed down as long as possible, as early as possible, and try to get as much things to support that. But regardless, you should, put something in your heel, and they should, the ER should provide you. If you don't, try to get something like a heel razor, that'll give you about 2 to maybe 4 inches of, a heel, a razor for your boot. And then crutches, of course, right? I think that's kind of essential too. I think if they don't give it to you, they might give you a wheelchair or something like that. But something just, these are just a lot of things to kind of cover, at least from your first day, experiencing or going through the ER process, right? And then, first couple nights, you can't really beat around the bush on this. It's gonna be kind of painful. If you didn't get prescribed medicine, I would say at least get 500 milligrams of acetaminophen, also known as Tylenol extra strength, right? You can get these all over the counter. I'm not a medical professional or anything, so just kind of, just sharing you what my experience was. Please talk to a doctor. Don't take advice from some guy on YouTube, with which milligrams or which pills to take. I'm just telling you what I went through, and what multiple doctors have prescribed me and what told me to take, from friends to my primary care. So just want to make sure that that's covered, right? So I got prescribed 500 milligrams of acetaminophen and then 81 milligrams of aspirin, right? Both over-the-counter pain relievers and anti-inflammatory medicine. Baby aspirin, 81 milligrams. It's basically there to prevent blood clots. You're supposed to take that twice a day. And then 500 milligrams of acetaminophen, also known as Tylenol Extra. You take that every 6 hours to help with the pain as well. And of course, take with food. So you want to make sure you get at least those medicine, and then of course ice it, throughout the first couple of nights, making sure that you kind of go over the worst 48 hours to 72 hours of just kind of this pain on your calves, where it feels like you have a calf strain, or you've pulled your calf that you just can't get rid of, and it's gonna hurt. But want to make sure that you try to have as much things to support you to kind of get you through the worst pain for the first couple days, right? So yeah, hopefully that covers at least for the first day. There's a lot in there. I would try to take notes before you go to the ER. With what you can do to kind of expedite a lot of your process, right? And then moving on to the first day. So unfortunately, I had to fly back down to California. And it's kind of sucked here because I had to take the plane, but shout out to Delta. They really did take care of me with getting a wheelchair and all that. So I was, it was pretty enjoyable, and they really helped me get from end to end. And with the airport as well, I was able to really get accommodated. So big shout out to them. So my first day, I really just called the VA down here in Palo Alto, and I wanted to just try to get an appointment with orthopedic as soon as possible. So it really depends. I know everyone refers, saying orthopedics, but also try podiatrist. For me, I was referred to a podiatrist. They kind of work kind of hand in hand, essentially. It seems like they're both in a gray area, and they specialize around the same, if it's a Venn diagram, they kind of work in the same similar area. Podiatrist works specifically on the feet, and then I guess ortho on tendon. I'm not really sure, but just making sure that, at least from my experience, I worked specific with a podiatrist, right? Even though I was referred to ortho. That's just what they offered, and I went with what the VA was able to provide me with. So here, I was very fortunate because this was only within 48 hours. I got my Achilles rupture on the first business day. I was able to get an appointment, which I'm very thankful for. And here I got an appointment with podiatrist and VA. I would probably go with ortho regardless. but I was able to get an appointment. And then from that appointment, I got my MRI scan, and then I got a tentative surgery date a week later. I didn't really, it wasn't official here, but I was able to at least have that discussion with my podiatrist, and then, also have a follow-up, have a couple of days follow-up to kind of think about if I want to go the surgical or non-surgical route. And then, have a second opinion from the MRI scan, which takes about 48 hours to get the orthopedics or the MRI results, right? Which is basically the certification that you got your Achilles torn. So, it's something, these are some things that, you're going to kind of go through the first, at least from their first orthopedics appointment. And it's going to vary from people to people, right? So kind of just summarizing everything, right? From your initial ER visit, urgent care visit, you're gonna want to get your X-rays, an MRI, which both is kind of irrelevant, from a lot of doctors are saying, but it might help you out with your insurance or something like that. But it also gives you a certification, to proceed forward with surgical, and you got your tendon ruptured, right? And the best advice I've got was basically until somebody else tells you otherwise, your Achilles is ruptured unless proven that it's not, right? And this kind of gives you a clear path forward to decide if you want to go surgical or non-surgical, and use this evidence to get opinions from other medical professionals, right? From orthopedics to podiatrists, surgeons, right? So those 2 exams done, right? Of course, get your crutches and boots, and I'll talk about different products too, maybe in another video. But you want to get your crutches and boots, and then a knee cart, and then a shower chair. I would just order these things as soon as possible, and then just so that you're taking care of at home. And of course, those 2 painkillers I mentioned, which is aspirin and Tylenol Extra, and then trying to make sure that you're at least going through each day, with much handicap as possible, right? With much support as possible. And then while, of course, trying to get, the administrative stuff done ahead of time, so that you're actually able to, expedite the process, especially if you're going to go the surgical route, and at least know what, next steps are. Okay. And that's it. So that was the first kind of 72 hours. I know that was a lot. And then in the next video, I'll kind of talk about, from, my surgical appointment date, and then my second opinion, and so on.